You have always stressed on the word stress. So if we are able to overcome stress, I think that is the solution for so many problems.
Especially women, younger generation, we see a lot of anxiety in them, lot of depression, whatever the reason, job, workplace, and family. So their priorities are much more towards kids and family. So they ignore the symptoms and then they present to the doctor late. So we miss the disease most of the times.
Any particular kind of a food that a woman should avoid after 50 for healthy heart?
So food, we avoid salt, excess sugar, avoid saturated fats, processed food, processed meat or whatever junk food you need to avoid, and stress more on whole grains, millets, and take a lot of fibers, include fruits and vegetables in daily diet. That is more important.
Anything for, now we are in summer, so anything summer specific that women should eat for a healthy heart?
Woman should keep herself hydrated, especially in summers. So you eat fruits which contain a lot of water, like watermelon. Frequently take coconut water, fruit juices. So that will keep her hydrated and prevent problems in summer.
So you should not let your body go dry. So, but at the same time, see, many people have the habit of drinking coffee. So coffee will also make you feel very dry. Would you advise that too? I mean, what would you say, that you should take it less?
So excess coffee also is
not
problem.
good.
So 2 to 3 cups of coffee a day is permissible. So as coffee contains 80 to 100 milligrams of caffeine, so that much is allowed. Excess coffee is also,
I think last time also you have told, like, excess of anything is not good. Everything in moderate is always good. And you also emphasize that, heavy food, if you eat, then you have to go work it out, and then you have to just get rid of it, burn the fat. So that should be the motto. Doctor, coming back to heart problems in women, what are the specific heart problems that which is very common nowadays?
So as I told you, hormones play a major role in women's health. Till menopause, estrogen protects the heart. After they attain menopause, estrogen levels reduce. So then the risk of heart disease is same as in men. Second thing is the period of pregnancy. During pregnancy, they tend to have high fluctuation of blood pressures. That is called pregnancy-induced hypertension. So that can affect the heart, and they can have shoot up of blood pressure and strain on heart and heart failure and also such kind of things. Then diabetes also can come during pregnancy. That is called gestational diabetes. So ladies,
and it ends up remaining also.
Women who have pregnancy-induced hypertension and gestational diabetes, we have to follow them up. So because the hypertension and diabetes can remain in their future life. Third thing is the women, they are prone to autoimmune disorders, diseases like rheumatoid arthritis or lupus, SLE, systemic lupus erythematosus. These diseases are more common in women. So when they have such diseases, heart also is affected. The vessels in the body, the joints, heart, the muscle of the heart, vessels of the heart are affected. So they can have strokes, they can have present with heart attack and heart failure.
But is it all interconnected with weight, or something got to do with weight?
So as I told you, menopausal women, they tend to gain weight because of the changes, hormonal changes. They put on a lot of weight. There is a lot of bad cholesterol into the body. They reduce the good cholesterol, that is HDL. They become prone to diabetes, prone to heart diseases. So further thing is, if you see smoking also in women is
and nowadays I think smoking has increased a lot in women.
Smoking has become more and more women are
it's become very common.
So that is, if you see the effect of smoking on the heart of men as compared to women have more adverse effects of smoking on the heart. So you should avoid smoking, especially if they are planning pregnancy. And then again, mental health, they are more prone to anxiety. They come with symptoms of anxiety. They have a lot of fear, palpitations. So that affect the heart adversely. So these are all the reasons and risk factors which women specifically have. So hormonal changes, autoimmune diseases, habits, and mental health. So all these we need to consider, especially when we.
So you would say, especially after the age of 35, or is it like even from 20 itself, a woman should be very careful?
Yeah, careful. Sometimes younger women, they have a condition called PCOD. So these are seen in younger women. So there also a lot of hormonal imbalance is there. So in a woman who has PCOD, there is chance of stroke 4 times as compared to normal women. And heart attacks or heart diseases are double the incidence what we see in normal women. So younger generation, these are the problems.
Yeah. So overall, I think as a woman, everything should be in balance and a check, from be it food, exercise, taking care, no stress. And I think like last time it all boils down to stress. And if you're doing good, then...
Yeah. So most of the conventional risk factors are same in men and women. Only thing is women, they have a typical presentation of any heart disease. They may not have typical chest pain as the men get. So you tend to miss the problem, and the woman, they consult the doctor in a late
much later.
Much later. And that's how we miss the disease, heart disease in women. That is the problem. So a typical presentation, we need to keep high index of suspicion and evaluate such symptoms and prevent further complications and risk.
So doctor, what are the typical symptoms that I would say is nausea, vomiting, or say indigestion? Are these also red flags in a woman for any heart issues?
Actually, the indigestion or dyspeptic symptoms are mistaken. They are commonly mistaken as gastric problem, but the woman may present with such complaints for heart disease. So we need to be, whenever a woman comes with epigastric burn or some kind of dyspeptic symptoms, we also need to keep heart disease in mind. So most of the times heart attack, that is angina, is atypical in women. So most commonest symptom they present is with gastric symptoms. So they tend to consult gastroenterologist, then the gastroenterologist gets suspicion, and then they refer the patient back to a cardiologist. So that is the common scenario which happens. So we need to evaluate them properly, take an ECG, do an echocardiogram, and then detect the problem and treat accordingly. So any woman who is a middle-aged woman who comes with pain from the jaw and below and above umbilicus, any pain in that area, we need to consider it as angina or heart-related pain and evaluate accordingly. So we need to rule out heart problem, any patient coming with pain in this area. Pain may not be typically in the chest. They may have shoulder pain, left shoulder.
So tightness.
They may have tightness. They may have backache, neck pain, on sweating, giddiness. So associated with nausea and some breathlessness. All these symptoms have to be.
All these are like the symptoms.
Symptoms, especially because women, they have all atypical symptoms. So we need to be careful and evaluate properly.